Today I'm going to be talking about the electronic media and the impact it has on our children's mental health. And this is something that is really important that I think we all need to be cognizant of, and a topic that I think it's important for us to bring up with the patients or the parents and the children in clinic.
This is Dr. Dalal. I'm one of the developmental pediatricians at KidsHeart. We really appreciate you giving the lecture this morning. We're ready to get started when you are, Dr. Shola. Thank you.
Okay, so again, good morning. I'm Shola Faniran. I'm a developmental pediatrician and I'm currently at Mediclinic City Hospital. First of all, I want to thank the team at KidsHeart for organizing the CME series, and in particular for asking me to share some of my interests with other pediatricians and other clinicians. So today I'm going to be talking about the electronic media and the impact it has on our children's mental health. And this is something that is really important that I think we all need to be cognizant of, and a topic that I think it's important for us to bring up with the patients or the parents and the children in clinic. So the learning objectives for this will be, number one, to understand what media is and how, has differed over the generation, and also how it has had an impact on our children's play and social interaction. But of course, it's not all bad. So we're going to talk about some of the benefits of it and then focus on some of the negative things that come with too much media use and the current epidemic of media use. And last of all, we'll talk about what we can do about it together. So this screen just shows a brief differentiation between the different entities that constitute media. So on the left column, we have what is traditional media: television, radio, music, movies, print media, newspapers, magazines, books. And now the new media, which they've put categories into it, including ebooks and in particular social network and streaming. So in the good old days, we mainly had broadcast and print as what the media was. So in my generation, when I was growing up, we mainly had broadcast and print. And now we've been bombarded with this new media that keeps growing every single day. So this is an old slide, and it's just a snapshot of the different kinds of social media that's available. But for example, this doesn't include TikTok, which has taken over a big part of social media. And I'm not sure there's a new kind of I guess, something like Google that's supposed to be better than Google, actually. And it's supposed to be like a search engine. And it's called ChatGPT. It's come out recently, but it's causing an issue, because now children are going to ChatGPT and asking it questions. It's like artificial intelligence, and it's actually going behind the scenes, collecting the information and producing it in a written document. So teachers are now seeing 6-year-old and children in year 6 producing things that definitely might be university level because they've had access to this. So this has to change the way teachers are producing work as well. So again, this is a slide talking about how much social media is being used all over the world. And as of the time of this slide in 2020, about 4.4 or 4.5 billion people were actively social media users. And then if you go along to the blue picture here, the blue circle, this talks about the annual change in the number of global users. And if it's growing by 520 million per year, fast forward to 2023 now, you can imagine the number of people that are involved in social media use. So it really is a pandemic taking over the world. Again, this looks at some of the social network platforms in the UAE. Again, it's an old slide. And at that time, YouTube was the top. And I might dare say that maybe TikTok is vying with YouTube now for its money, for the number of people that are on TikTok, in particular the younger generation. and add on to it Instagram and all the reels that's available now. You can just sit there and you just consume video upon video that is out there to gain your attention. So Generation X, those born between the 60s and 80s, which is a significant number of us that are on this talk today. Then play for us was going outdoors, going into the playground, getting dirty. You go out during the day, you have to be called in for dinner. But nowadays, this is what we see in the playground with our children. Almost every child has a phone, or if they don't have a phone, they're going to have some sort of device. They have iPads. Some parents that were trying to contain it for their children, bang comes COVID-19, online learning. We all have to find a way to teach the children, and every child now has an iPad, down to those that are in junior primary school. So you end up seeing these children in the playground, and in my clinics, when I say, who did you play with today? They say, oh, our teacher allowed us and we were on our devices. So this is the way they see play nowadays. So in 1996, parents actually have to drag their children in from play. But nowadays, parents have to actually drag their parents to come out and play. And the change in play has gone from being outdoor, unsupervised, prolonged. Now it's all indoors. Again, it's still unsupervised. It is prolonged. They are having some social interaction there, and they feel that they're being mentally active as opposed to physically active, which is what we had before. This doesn't only relate to the children, it's also the adults. Because I come in to my clinic and I'm looking in the waiting room with parents that have brought their children to see one of the various pediatricians we have. And it's either the parents are on their phone and the children are on the iPad, or the parents are on the second phone and the child has their own phone and everybody's consuming some sort of media. We've now turned the device into the babysitter. So this, I'm not sure if you've all come across the still face experiment. They've also done the still face experiments in children using your mobile phone, just to show how much impact this has on children. So I'll just see if I can play this, bear with me. Okay, so this is the original still face experiment.
Are extremely responsive to the emotions,
can you all hear
the
it?
activity and the social interaction that they get from the world around them. This is something that we started studying 30, 40 years ago, when people didn't think that infants could engage in social interaction. In the still face experiment, what the mother did was she sits down and she's playing with her baby, who's about a year of age.
I'm like a girl. Oh.
And she gives a greeting to the baby gives a greeting back to her.
Yeah.
This baby starts pointing at different places in the world, and the mother's trying to engage her and play with her. They're working to coordinate their emotions and their intentions, what they want to do in the world. And that's really what the baby is used to. And then we ask the mother to not respond to the baby. The baby very quickly picks up on this, and then she uses all of her abilities to try and get the mother back. She smiles at the mother. She points because she's used to the mother looking where she points. The baby puts both hands up in front of her and says, "What's happening here?" She makes that screechy sound at the mother, like, come on, why aren't we doing this? Even in this 2 minutes, when they don't get the normal reaction, they react with negative emotions, they turn away, they feel the stress of it. They actually may lose control of their posture because of the stress that they're experiencing.
Okay. okay? I'm here. And what are you doing? Oh, yes. Oh, what a big girl.
It's a little like the good, the bad, and the ugly. The good is that normal stuff that goes on, that we all do with our kids. The bad is when something bad happens, but the infant can overcome it. After all, when you stop the still face, the mother and the baby start to play again. The ugly is when you don't give the child any chance to get back to the good. There's no reparation, and they're stuck in that really ugly situation.
Okay, so this is the still face experiment is a very old experiment that is really relevant to attachment and social emotional development of children. And I dare say that that still face that the mother showed during the experiment is exactly the same that we give our children and our babies when we're on the mobile phone, because we've cut off from them and we're not engaging. And so this one is what some people did with the baby, but with the mother on the phone. You can see again, the baby's trying to get the mom's attention, smiling, moving, very similar to what we saw in the still face experiment. And the sneezing is part of some of the autonomic response that the children get. Baby's cooing, trying to get the mom's attention again. Until the baby gets distressed and then the mom pays attention. So I dare say that this is obviously having an impact. And I'm not sure how many people have seen this next video I'm going to show. It was going all around Facebook several years ago, and it was meant to be funny, to show how a child reacts when the phone is taken away from a child that still really shouldn't know what to do with a phone.
Can I see this?
And this is the kind of reaction I'm getting in 6-year-old, 8-year-old, 14-year-old teenagers when the device is taken away from them. I had a case in clinic recently that the mom came in really upset. Child had ADHD and a disease. The nanny had been saying, get off the device. Child refused. The nanny took it away and the boy punched the nanny in the stomach. Now the nanny wants to leave. This is what we're doing to our children.
Hi.
The other challenge with it is that a lot of access to screen time is not being monitored by parents. So this was a study done in the UAE in 2017, where it showed that 2/3 of UAE parents do not limit access for their children. They do not limit their access to screen. They do not limit their access to online or apps or websites. And 1 in 5 parents do not monitor what their children are watching. And 86% of parents allow their child to play older games that is recommended. So most of those games will come with a recommendation of 18 plus or 13 plus, but I have 8-year-olds that are telling me about Call of Duty and all these games that are obviously beyond their age. So as I said, there are positives and negatives to social media. So let's talk about the positives of the devices and media generally. One thing we have to realize, our children and the coming generations are digital natives. They're born into it. Social media has existed for as long as they can remember. They don't know anything else. And the bottom line is it is here to stay. We're not going to get rid of it. Even us as adults and clinicians are making good use of social media. And some of us have been trapped into social media. So it is here to stay. And what we can then do, the key to making this successful for our children and coming generation is to make sure that we choose appropriate apps for the children. One that has appropriate content and those that are age appropriate. And also to limit their time. We have to set boundaries. And not just set boundaries, but it has to be enforced. Now, even in times when you allow your children or you encourage parents to allow their children in this limited time, parents have to spend time watching what their children are watching, in particular the younger ones, so that you can put context to what they are watching and they do not run away with it, making their own interpretations on what's been told them by school. So the positives of social media is it does encourage creativity. So for example, I have young patients that are really into coding. They're really into developing a website. I have one that has a YouTube channel that puts content out there. So it does help with their creativity. You have apps that help them with creating stories. I have some that use different apps with their drawing and they create amazing pictures from it. It also helps with problem solving because again, there are things that help them to choose, to decide, to have an idea of what is appropriate, all within the game. So all those are positive. For me, we use a lot of communication apps for my children or patients that are nonverbal. It also helps communication for the children because they're listening to words, they're having opportunities to play games with words. So yes, it does have its positives. A lot of children nowadays socialize a lot on their games. So they have multiplayer games where they're interacting with their friends virtually. It also, the new craze now is these roadblocks and there's another one, I forget the name, that the kids are into. It does help build creativity as well. It helps with planning and it also helps with their pre-academic skills. So there are positives with the media, it's not all negative. But the problem of it is the people that develop these games or the people that develop the social media apps, the ones that come up with the reels, they're tapping into psychological biases and vulnerabilities, things that they know will interest you. They're tapping on affairs of acceptance or rejection. It's almost the same way that a drug dealer feels with a hit is what some people feel when they look at their Facebook or something they've put out there and they see the number of likes. It gives them this dopamine jolt. So it is targeted at getting you hooked and wanting more and more and more of it. And there have been studies to show that passive use of social media, so passive use means you're not the one putting stuff out there, but you're just flicking through people's Facebook pictures, you're flicking through people's Instagram pictures, trying to, live their life vicariously, forgetting that people only put out things that are positive, things that are good. They don't put out the sad things of their life. You forget that, and it does lead to feelings of envy and inadequacy and less satisfaction with your own life. Because you're living a normal life, you know your life, but you're only seeing the best part of other people's life. You're only seeing their holidays when things go well for them. And it's also been suggested that it can lead to ADHD symptoms, depression, anxiety, and sleep deprivation. The other downside is it exacerbates loneliness. It makes you feel lonely, right? Because you go in there and you feel like you're connecting because you're in there for a while, but it's all superficial connection. There's no deep connection that people really care about what's happening to you. And as I said, every one of those designers design it for excessive use so that they tap into these normal biological responses that trigger the reward system and make people want to go back over and over and over again. The other big problem with current access to media and the internet is the issue of cyberbullying. Bullying amongst children or amongst people has been ongoing for as long as we know. But in those days, you get bullied in school, you leave it in school, you come home, which is a safe environment. But now, kids that are being bullied cannot escape it. And even nowadays, there are people that they call trolls. So you put something out on media, and there are people that troll different postings to write negative things there, to write hurtful things there. And unfortunately, victims of cyberbullying are more likely to have alcohol and drug use, and there have been cases of suicide associated with cyberbullying. Now, the new thing is this gaming addiction. And I'm seeing that a lot in my young children, anything from as young as 8 years old up to teenage years, that they become addicted to games. And all they want to do is stay in their rooms playing games. And the parents have lost control. So now in DSM-5, they're now talking about a gaming disorder and described what it means. And it's also in ICD-11. So, this showed that 45% of people feel worried or uncomfortable without email or Facebook. And unfortunately, this is not a live setting, but it's at this point that I'll ask people to put up their hands. How many people, the first thing they do when they wake up is just stretch out their hand and grab for their phone? It's almost this feeling of being left out. The first thing we all do, we grab for our phone, we want to check messages. Half of the time, the messages are totally irrelevant because we belong to multiple WhatsApp groups that keep bombarding us with messages that are totally irrelevant to our lives. But we always want to check them because of this feeling of worry of being left out. And 9 in 10 people in this study will feel panic when their phone batteries go below 20%. And people will run back. It's almost like a medical emergency if you've forgotten any of your multiple devices, and feel panic if you lose, that you might lose your smartphone. So what can we do about it? Because we really need to start tackling this. So parents really need to start talking to their children about internet use and social media. You have to have that conversation at a very young age. But you also have to lead by example. So for example, I was talking to one of my families yesterday where the dad was saying the phone was becoming an issue and they have family time. And I was suggesting to them that they should sit down and have rules and boundaries within the family because the children are now older. And also to have, again, like a jar where people, you can catch each other. When you break the rule, you have to put a dirham into the jar. And the thing they were talking about was family time. And their rule at home is during family time, which is maybe an hour or two watching a movie, playing a game, nobody should touch their phone. At meal times, nobody should touch their phone. And this should apply to the whole family, but not use it as a punitive thing that causes a fight. We all agree. And if you're caught using your phone, you accidentally reach for that phone, a dirham goes into the jar. And then at the end of the year, you can all decide what you're going to do with the money. So it makes people aware that we have to set boundaries. We need to control ourselves on our use of social media. And the adults have to lead by example. Parents need to talk to their children about cyberbullying, about what's happening on the social media. Because if you don't ask, these children will not volunteer. We need to become more tech savvy. If you're not, you need to find people that are tech savvy. You need to learn how to put filters to block harmful things, harmful content from our children. And as clinicians or teachers, we need to disseminate first of all, you need to educate yourself, like we're doing, talking about this. We need to know what the guidelines are. We need to know what we should be telling parents, what they need to do with their children. So for example, when I'm talking about recommendations, they ask me, do you think that my child, can we use a bit of iPad or show some things to the children? But then we have to say, look, yes, you're allowed at a certain age, but the more important thing, in particular in my younger children, that you also need to bring it to life. So if your child is watching a program, then get a piece of paper, get some clothes, do dress up, bring it to life for them, make it more actionable as opposed to the passive media consumption that they have. So for the children, as I said before, we really need to set boundaries, and we need to enforce those boundaries. The government have to come in here. There has to be regulations on how we have to deal with this, because this is getting a life of its own and it's getting out of control. We need to be advocates as clinicians and pediatricians, lobby the government to have guidelines, just as we have guidelines on cigarette smoking, just as we have guidelines on alcohol use. We need to start having those serious enforceable guidelines on the media, and also keeping the people who develop this accountable as well. Put fines out there so that we can start working together to help our children. The social media companies have to be put accountable as well. And we need to encourage them to keep producing age-appropriate content while they can still make money from it. And that's just some of the references. And that's my email if anybody wants to be in touch. Do we have any questions?
Thanks a lot, Dr. Shola. That was wonderful, a very hot topic and important topic. We'll just see if anyone has any questions for the next few minutes. Someone's asking how to reduce the addiction or how to de-addict them.
Okay, so now that depends on the age of the child. In the younger children, it's called turkey. Just get rid of the device. Get rid of the device, but when you do get rid of the device, you have to replace it with an adult interacting with the children. And I have seen, so I see a lot of young children under 2 I'm talking about, that the parents come in and say they're worried their child might have autism because they're not interacting, they're not giving eye contact. When we call them, they don't respond to their name. And sometimes the act of getting rid of all devices and interacting with the child on its own is enough to make a big difference in the child. Now, don't get me wrong, those children still need somebody who knows what they're looking at to check, to do an assessment, to make sure it's not autism. If it is or if it isn't, getting rid of it is enough. But now when we talk about the older child, it has to be in twofold, because remember, these children are already addicted to it, and you have this really violent response when they are asked to stop. So it's first of all, talking to them, setting the boundaries, having a plan, and working with a behavior therapist to help you deal with the negative consequences of enforcing what you have to enforce. And over time, it results in behavior change.
I think there's a couple more questions. They're asking, I guess, about a specific rehab there is for reducing the addiction for children in the UAE. It sounds like more of a rehab center.
Sorry, I can't hear you very well. Can you repeat that again?
Yep, they're asking about if there's a rehab for children to de-addict them in the UAE to reduce addiction.
I don't know of any rehab place that does that, but I do know psychologists that are trained in working with addiction that can help the children. And because really, at the end of the day, you have to treat it like any other addiction. It doesn't matter what it is, alcohol, pornography, whatever it is. We have to walk along those lines and use the steps. So yes, there are psychologists, but I don't think there's a particular rehab center or anything that works with children.
And then the other question is, what is the age appropriate, I guess, age for kids to be allowed on social media like Instagram and TikTok?
Honestly, with social media, so for example, Facebook was the first one that put it out there and was saying age 13. With the newer ones, they are not putting any guidelines there. But I'll put it back to the parents that you know your child better and you know the the maturity of your child. So children are going to be interested and want to get into things like TikTok. So for TikTok, yes, you can have a look, but see how well you can control it. In my mind, any child that is younger than preteen, so anything from 12, 13, the guidelines set by Facebook initially, might be a bit too young because they will be exposed to content that is not age appropriate. So if you are going to allow your child, I'd say maybe not for them to have their own account, but sitting with you and doing things together or directing them to a more age appropriate social media device or program or app that you know only has child appropriate content, because the content out on TikTok does not differentiate by age. Neither is the content on Instagram. And because Instagram has an option of messaging, you really don't want anybody having access to your child and being able to message them. So again, it's something that you have to closely monitor. It's something that even when the child is old enough, that you have to do check-ins to make sure that things are not happening behind your back.
And Dr. Shola, there's a question about the role of school and the general pediatrician in screen use.
Okay, so the role of school and pediatrician was one of the slides that I shared earlier on. Number one is for them to be aware. You need to know all these different apps yourself for you to be able to chase after it. Number two is school in particular to work closely with the parents, because school nowadays is setting a lot of homework and things on the screen. So you need to work with parents and know how we're going to limit this, how much homework is really given, and how can we use the school iPad only for school things. So they need to put locks on it. So other things cannot be put on it and the children will be saying, oh, I'm doing homework. And they need to have talks with the children. Keep reminding them of what's accepted, what the law is. So for example, I know the law in the UAE about posting people's photographs without permission is a big deal. But a lot of children do not know that. It can lead to negative consequences. They need to make their students aware of that and work with the parents. And also encouraging the parents to lead by example. You need to support the parents with that as well. For pediatricians, I know we're all busy, right? We're seeing kids every 15 minutes, but you need to take the time to ask that question and broach it with parents. And also have in your repertoire places you can send them to get help so that the parents can feel supported. Because honestly, we're talking of an addiction. We all know how bad an addiction can be and how kids can react because, again, the frontal lobe is not well developed. They can get aggressive. And it's easy for us to sit behind the desk and give the instructions. We need to have a way of supporting the parents on how to do this successfully.
Dr. Shola, I had a question from a developmental pediatric standpoint. So a lot of the patients and families I see will come in with a lot of blame as to why, or trying to blame one another as parents, or each person trying to blame themselves as to that the screen time and social media was the cause or direct cause for an autism diagnosis. And there seems to be a lot of conflict between parents about that. So you let him sit on the screen, no, you let him sit on the screen. And that turns into kind of a conflict within the office. I wonder what your approach is when families ask you if that was a direct cause as to what caused this, because I tend to kind of say social media doesn't help in general, even for neurotypical children. But I think they dwell on the fact that it was the cause for why the child ended up with an autism spectrum disorder. So I wonder what your approach is from a clinical standpoint as to how kind of you approach that with families.
Okay, that's an excellent question. Now, parents will always blame themselves when things go wrong with their children. And one thing I try to impart on parents before they leave my room, when they come for that initial assessment or whatever it is, when we have the conversation that your child might be on the autism spectrum, is that this is not their fault. It's a neurodevelopmental problem that has happened. It is not anybody's fault. It was not caused by social media. It was not caused because you were, whatever it was, you were stressed at work, whatever it was, you had a fight. That is not what's caused your child's neurodevelopmental issue. But now that we know the issue is, what we do about it makes a huge difference. Being exposed to social media does not cause autism. I had a parent come in and was saying there's a group that's talking about virtual autism related to social media.
Mm-hmm.
That is not autism. That's not what caused autism. But if a child has the tendency or the predisposition, exposure can make it worse. Exposure can make things worse than they are. So I reassure them to remove the blame, because we need parents to be working hand in hand together and not fighting each other for the child to be able to progress and develop. So I try and remove that blame part, leave that. But now that we know this child is having issues, where do we go from there? Let's draw the line in the ground. And from now, we're going to limit screen time because it's not useful for anyone. And if we do have screen time, we're going to use it in a more appropriate way, in particular with children that are on the autism spectrum. Just having screen is not good enough. Even if you allow them screen, you need to make it reality. You need to bring the piece of paper, you need to bring the reenactment back to the children to help them with their imagination.
Thanks, Dr. Shola, and I appreciate you clarifying that. I think that's a really important point for if we have any general pediatricians on the line, therapists in general, just to clarify, not to fully blame or say that this is what caused it, because I have a lot of parents that will come in even saying that specific pediatricians have sent them to me, or a general pediatrician has sent them to me because social media has caused the autism. And so let's try and reverse it right now. So I think that's really important for all pediatricians to keep in mind, give appropriate and correct information to families, because really it does cause a lot of breakdown of families when you're giving one specific cause and telling them a false fact of remove social media and all is well, which again, it'll make it better, just like you said, but I don't think there's a clear etiology or ideological link to that until there's further research maybe in the future, but for now it's not. So I appreciate that, Dr. Shola.
Now, there was some research that was advocating for the use of online games for kids, especially the CP and the CP patients, and it said that it improved the development and their functions. Is that true? Because this is on and on brought up by parents as I'm trying to help them. This is very good for neuromuscular coordination, something of that, other than the excuse of the school asks for it. So if schools allows it, so it's good.
Thanks for that question. I'm not quite sure what app or program you're talking about, but there are some apps, there are some games that help children with whatever it's targeted at. But still, even with those games and those apps, they might be used by the speech therapist if you're working on particular aspects of their communication. It might be used by their occupational therapist. It might be used by their physio. But you still need to direct those children and those families back to evidence-based therapy. And if the clinician then wants to use it as an adjunct, that is fine. But it wouldn't be the sole thing that would use to say that this is what's going to help the child coordination or something like that. Because at the end of the day, except the app has a connection, or it's a case of the child is watching and copying, for coordination, you have to do. You have to move. It's not just from watching something. So if it's being supervised and they're using some aspects of it, yes. All these things have their perfect uses. Just as I said, it helps with communication and things like that, but it has to be used appropriately. And any of those, I haven't come across any of those apps that has evidence behind it that it helps and it improves things on its own without it being used properly by a clinician that is using it as an adjunct.
Yeah, yeah. And what about the area of the school? They are asking them for it. If it's asked by the school, it's safe, and why not to entertain after the schoolwork?
Do you have an example of one of the apps that they're talking about?
No, I mean, the parents would come in, if you ask them, please limit, because they would come in the waiting room, you will find the mom on the screen, each and every one of the kids is on the laptop of their own, and the maid is on her screen also.
Yes.
When you ask those parents, please limit, she would tell you schoolwork is all about the laptop. So why don't we add some entertainment time? It's safe, being advised by the school.
This is where we need to then advocate and speak with the school. But one thing that I do know from parents that have come to talk about school, and even my colleagues, other pediatricians, is to always take what parents say with a pinch of salt. Yeah, because they've come and they've told me that pediatricians that I know have said X, Y, Z. And I keep a straight face because I know there is no way this person will tell you that. Now, I'm not saying they're lying, but it might be their interpretation of things.
Yeah.
So I don't argue it, but I just say, really, well, this is what it is.
Mm-hmm.
So we need to reaffirm that really school said that. Well, we do understand that they do need it for school, and it's true they do. But how much homework does a child have in a day? Maximum 20 minutes to 1 hour. It gets more as it gets older. But then again, there are specific things. So with school, number one, if it's possible for us to have this kind of talks and meetings with school, number one, but more importantly, asking the parents. So most schools now will have online place where they share homework, where parents can also access, in particular the older ones. So you know what homework has been set, when it's due, and things like that, so you can monitor. Parents have to be engaged in that. Almost all schools have that now. So that way you tell them, speak with your school so that you two will know what is really expected, not what your child is telling you. Because sometimes it's not the teacher that said, it's the child that said the teacher said. Or my friend said the teacher said that we could.
Yes, right. Thank you, Dr. Shola. Very nice listening to your presentation. Thank you.
Thank you.
Thanks, Dr. Shola. I think that's all our questions for today. We really appreciate you giving this talk on such an important topic. And I hope everyone kind of took something useful away from the talk. Thank you very much.
Thank you so much for having me. Everyone have a good day.
You too. Thank you.